mentioned any kind of snoring is bad and we need surgery for that. Can you explain to our viewers like how is it bad? Like what are the adverse effects of snoring and what are the like? Is there only surgery cure option or there are other possible options also?
So as I had mentioned, snoring is bad because it basically impedes the growth of, if it's a kid, it impedes the growth. If it's an adult, it leads to more amount of stress hormone secretions. That's the corticosteroids or the normal steroids in the body. So as and when the steroid levels increase in the body, it will increase the chances of the person developing diabetes, the person developing hypertension, the person developing other sorts of heart-related issues, lung-related issues. So these two, just the diabetes and hypertension, are more than sufficient to cause a various amount of bodily complications. And many of the time, doctors would be giving a patient anti-diabetic medication and anti-hypertensive medications, but it doesn't work because the patient is snoring. So the whole issue of the patient developing snoring and developing these two kind of complications are essential to no, it's very, very vital that they don't snore. So when I mentioned that we need to assess, I mentioned we need to assess why is there snoring. I didn't say surgery is the main treatment. I told we need to first assess what is the cause for snoring. So snoring can be because of three basic causes. One is the nose, one is behind the other one is behind the nose, one is the oral cavity, another one is the hypopharynx or the airway below. So if at all there's any obstruction in any of those four areas, it can lead to snoring. So if at all there's any issues in the nose, especially nose and in the back of the nose, that can be addressed by, if at all they have allergies, we need to reduce the allergies. If at all they have a bent nose, the bent nose can't be corrected with medication, so the bent septum has to be corrected. If there's polyposis, we have to remove the polyps and also give them steroids to ensure that there's no recurrence. If there's anything behind the nose, we need to ensure why exactly there's a collapse there. So all those things we need to assess. Non-surgically, there are other things which can be useful, like the BiPAP machine, which goes onto the face and then gives them positive airway pressure. But also need to understand that that can be utilized if there is a normal airway. If there is an airway obstruction, unfortunately, we need to go for surgery. If there's no airway obstruction, we can use the mask and that will reduce the snoring. The main treatment for snoring is weight loss. If you lose weight by even 5 kgs, the snoring will reduce by 30%. That's provided if the patient is extremely obese.